So you go to a doctor, you got an issue, and they say, here, I could give you this medication if you want. And so what do you do? And I know a lot of purists will be like, refuse it, just diet and exercise or the natural method, whatever it is. But I think a lot of people, even the kind of people who watch this kind of podcast, are actually going to take it a lot of the time. The fill rate of prescriptions and the take rate is extremely high, especially when you first have an issue. Maybe over time it dwindles a bit. So in this episode, I thought, let's talk about the top 10 types of most prescribed medications. And then obviously this podcast is not giving medical advice, but we'll talk about if I was prescribed those medications, what would I do? And what type would I select? Because some doctors would give you options, and then of the options that they present to you, which would I take? And so in today's episode, we're going to talk about Elwyn's favorite drugs.
And yes, thank you everyone for joining us. This is the Rejuvenate podcast. Welcome. I am your host, Chrissy Hawks, and I am here with the wonderful Elwyn Robinson, the creator and founder of Genetic Insights and the author of the Rejuvenate Blueprint. So yes, as he's just warmed you guys all up to know what the topic is today, we are diving into Elwyn's vast research knowledge and his very, how can I say, well-versed opinions on what he would do personally, which I know I trust his opinion quite a lot. So I'm ready to dive in. So Elwyn, where do you want to start with what most prescribed drug?
Well, yeah, I gave you a list before, Chrissy. Actually, before we get into them, let me just talk about a tiny bit of background on this, which is I work with a medical doctor sometimes, and the reason is it's Dr. Miriam. It's not a secret. I think I've mentioned that before. And in fact, if you would like to work with Dr. Miriam and I, if you would like a very intensive VIP experience where we are very committed to your health. We are taking on, one new client at the moment. We only have a couple at the most. Right now we have two, so yeah, I guess we only have like 3 or 4 at the most. But anyway, so sometimes there is call for a medication, and in this episode I won't be talking about bioidentical hormones. Not because I'm not a fan. I might touch on it, but basically that isn't going to be a main category because I've talked about that loads of times before. I'm a big fan of those for people if they need them, especially as they're getting older. This is going to be other stuff, not all the stuff you've heard me say before. But I just want to, clarify this point because I know some of my followers, especially my followers who've been with me a long time, be like, Elwyn, why are you ever having any medication? And so first of all, we've got to be realistic, right? So the realistic thing is that in some cases, the natural alternatives just are not as effective. And, the first one that we're going to talk about is painkillers. And that's an obvious example where there just isn't a supplement that is as effective generally as drugs. And so most people, when they're in pain, they just take a drug. That's the reality. Doesn't matter if they're health gurus. Now, I know exceptions. I know people who never take painkillers. I personally hardly ever take it, and we'll talk about that when we talk about the category, even the most extreme circumstances, but for non-purist reasons. But most people do. So we need to talk about what the options are and what the best option is. And the other thing is, for the people like, oh, but it's not natural, I really want to emphasize that the line between foods, supplements, and medications is largely arbitrary. So meaning it's a case of where you choose to draw the line. And in fact, different circumstances will draw the line differently, and different countries will draw the line differently. So there are some things like melatonin, DHEA, for instance, which are classed as prescription only drugs in the country I live in now, the UK, but I can just buy them in the US and ship them over to me. That's totally fine and that's totally legal. So that line about which they are supplement drug is pretty arbitrary. There are even things like modified versions of vitamin B1 we've talked about, for instance, benfotiamine, some countries, drug, other countries, supplement. And then the line between food and supplements, again, like a lot of the time, it's like, is it a curry ingredient or, is it a supplement? It just depends. If you put, like ginger, garlic, curcumin, cumin, like all these things, fennel, like saffron, I could probably come up with 6 more. There's like a dozen things that all have powerful, like even sometimes, honestly, drug-like or as powerful and more powerful drug-like effects which are also just ingredients in everyday foods. So, the idea that there is this strict separation between these things, I think we need to disabuse ourselves of that. It's like, if it's in a meal, then it's a food. If it's sold, in a supplement store, then it's a supplement. And if you have to go to a pharmacy to buy it or get a prescription for it, it's a drug. But often there's a huge amount of overlap. So I just want to clarify that really key point, because otherwise, when I'm talking about, you could do this, you could do that, you could do this light stuffing, you could do this medication, people are like, oh my God, that's totally different. And I'm like, not really.
No, absolutely. And one of the things, especially in that opener, what you did say is that doctors will offer you a drug specifically. And that's why I'm really looking forward to this episode today, because you have certain recommendations, because they do know, especially in the long list of medications that are out there, there's quite a few different options. And at least I know in the States, maybe that's not representative here in the UK, because it is a private industry over there. Doctors will have certain affiliations with certain drug companies, and therefore they will be recommending a certain one. And so that's also too where people may sometimes not know that they do have a choice. And so by having that education and understanding, well, you have choice A over here or choice B, actually B might be the better choice for you. So it's that understanding too of always bringing the information, the education, so that people have the power to choose in their hands.
Yeah, and to be honest, in countries with socialized medicine like the UK, it's worse, to be honest, because there's these NHS recommendations and there's really only like one thing they're allowed to offer you. So when I'm phrasing it that way, I'm really phrasing it that way specifically, because if a doctor tells you must take it, then like I can't tell you not to. So I'm just saying, let's imagine you have an issue, you go to a doctor and the doctor says, would you like me to give you a medication? That is the hypothetical situation that I'll be discussing here. And then I will be discussing what I would say in that situation. Do with that information what you will.
So let's kick it off with pain relievers. Where do you want to start?
Yeah. So pain relievers, you and I talked about this briefly in the pre-interview, Chrissy. So most of the time when you have any kind of pain, it's kind of routine to be offered, and often actually it is a case of offered. It's like, would you like some? Um, and it's usually paracetamol, ibuprofen. What are they called in the US, Chrissy?
Yeah, we've got
is it?
Tylenol over there. Yes, and yeah, ibuprofen. Well, we tend to go by brand names. So Tylenol is actually acetaminophen, and Advil is the ibuprofen.
Okay, there you go. So that's the US equivalent. So that's pretty much what you're given. And most people just take those without thinking. But they have, fairly serious consequences, especially with high use and especially long-term use. And also, I rarely take them just because I have not found them effective for any of the types of pain that I've had over the last 20, 30 years. I mean, the last time I had pretty bad pain is when I had a dry socket a couple of years ago, which is where you have a tooth extraction. This is something that's been loose for years, and I finally got around to getting it out. And unfortunately, and this may have been my own fault because of something that I was doing, I ended up, so it's where the clot doesn't form and the nerve is kind of raw, and it's supposed to be, some people say it's the worst pain ever. I don't know. It wasn't good, I'll put it that way. And it lasts like 3 to 4 weeks, and there's nothing that they can really do about it either, like the dentist or a doctor or whatever. And so I was left with pain management options, right? And this is like a constant, really bad pain. I won't say the worst ever, but it's bad. And so I was, I had options. What do I do? And I looked it up, and this country, they basically hardly ever prescribe opiates. That's one of the things that's different from the US. But hardly ever. I mean, it did happen once when I had my foot infection that they gave me morphine, and I just found it wasn't very effective. And, I know that there are various different types. I found it's quite good for putting you into a disassociated state where you just don't care about the pain, but it doesn't actually address the pain. Now, in that specific instance, I ended up doing a non-painkiller method, which I'll talk about in a second, which was actually more effective than any painkillers. But what I would normally do if I had any kind of normal pain is actually go for aspirin.
Why would you go for aspirin?
So aspirin is, one of the original painkillers. It is kind of natural. It's acetyl salicylic acid, I think. So basically, salicylic acid is a plant compound created by plants that help the plants produce energy and stuff, and it's bound to like a vinegar group, like an acid, and then it goes into your stomach acid. Your stomach breaks it apart. So this is actually a traditional like medicine going back hundreds of years at least in herbalism, probably thousands of years, of white willow bark.
Yeah, I was
If
going
you've
to say
heard
it's
of
from
white
a
willow
tree.
bark.
Yeah,
Yeah,
yeah, yeah.
exactly. So, but that's just where it's highly concentrated. As I say, most plants actually have this in. This is like a pretty universal compound. So it is natural. Maybe it doesn't matter, but it is. And then second of all, it does have a bunch of different health benefits. There are people using it, claiming that it reduces your risk, or even as a treatment for the C word, which is a really big deal. Bunch of research into that. There are people who talk about extending lifespan. There was an interesting thing I saw about like a study where insurance companies were against the long-term use of aspirin because it extended people's lifespans. It's a mitochondrial decoupler, so it definitely makes you warmer. It's an anti-estrogen agent, an anti-serotonin agent. So there's loads of stuff, and probably the camp of people who I've seen who are most enthusiastic about taking aspirin, other than just like maybe your grandmother or your great grandmother kind of thing, because there's that kind of colloquial wisdom, is followers of Dr. Ray Peat. They love aspirin. Sometimes they're using huge dosages. So, the standard dose of aspirin, I think, is 200 milligram. And then there's the baby aspirin, which is about 50 milligram. But some of these Ray Peat followers are using like several thousand milligrams a day, and claiming nothing but benefit. It even, like, it stops you being sunburned, for instance, is another thing. It just has like a crazy list of potential benefits. Oh, and I haven't even mentioned the most obvious one, which is that it's a blood thinner, and so it helps prevent heart disease and heart attacks specifically. So there are loads of good things about it. Now, there are potentially some not so good things about it. Some people have salicylate sensitivity, so it's going to create all kinds of issues for them because their body doesn't process it very well. And there's a genetic basis for that. And one of our reports in Genetic Insights, we do provide that. And I do see that with people when they have that and they stop having anything with salicylates in, that they feel better. And it's not just white willow bark. Another thing that's really high, for instance, is cumin seed oil. Is really, really high in salicylates as well. So there's a bunch of natural things that are high in it. But anyway, like it's a mitochondrial decoupler, which makes you feel warmer, which is a big thing in the Ray Peat community as well, is to increase their temperature. So it does absolutely work for that. But mitochondrial decoupling is generally what happens when your body has like got enough energy, and then to stop it overproduce energy, the mitochondria will then decouple and they produce heat instead. Kind of potentially to force that decoupling and put it into a heat creation mode when it hasn't created enough energy yet is something that maybe aspirin does. And then, the more well-known side effect that is what all the medical community talk about as to the excuse why they don't prescribe it anymore is because it is blood thinning, and so it can produce like internal bleeding. Like, for instance, it can contribute to stomach ulcers. I find this last one, to be honest, a particularly weak excuse because so does ibuprofen. And so they say with ibuprofen, well, you're going to take it with food. It's always like a big thing. And so I have not seen any evidence that ibuprofen along with food is any more safe in that regard than aspirin along with food. But I have not seen the huge list of potential benefits of ibuprofen like I have seen with aspirin. So I can't see any reason why anyone would ever take ibuprofen or paracetamol over aspirin, except for over in the kind of situation I was in, which is where you've got a hole in your mouth and you want a clot to form. So it's a blood thinner. So in that case, before a surgery, immediately after surgery, these kind of very specific situations where you want to discourage blood thinning and you want to discourage bleeding, then yeah, you would not use aspirin. But then I wouldn't use ibuprofen in that situation either.
What would you use?
Well, so so the problem with paracetamol, the other common thing, is that it's liver toxic. So even though my liver's fine, I just don't like the idea of that. And I've had IV paracetamol, like, I don't know, 15 years ago. I found that was very effective when I had the pain in my when I had a foot infection, much more effective actually than morphine. But I've never found oral paracetamol to be very effective. I did not find it effective at all when I had my dry socket. So I actually just ended up using CBD. And so we talked about CBD in a recent episode. It is partly works like morphine in that it kind of just disassociates you and it's like you're still in pain, but you don't care as much. But it also has a genuine anti-inflammatory effect. And again, I won't repeat all that because I talked about it a few episodes ago in my favorite supplement series. So that would be my other go-to thing in that kind of more acute circumstance if aspirin just wasn't suitable. And then the other thing that I used, which was very effective, was a clay poultice, which I know that sounds crazy, but some of the times in my life where I've had the most terrible acute pain and the dry socket, I don't know, last 10 years, certainly it's up there. And then when I had the foot infection, which was definitely the worst pain in my life, my ankle was like 3 times at least the circumference as before. It's the only time I've ever been to an emergency room and like all the doctors and nurses crowded round rather than just sitting there and ignoring you, as that kind of situation. They gave me all, IV antibiotics, IV painkillers, all this stuff. Nothing worked. The only thing that worked for that was a clay poultice. So that is getting bentonite clay, putting it in water, putting water in it, turning it into a paste and rubbing it on the area. So that worked fantastically for that ankle swelling, so-called infection, but that's what they said it was, but they never, I don't know, proved it. But that was, I told that story many times, but they told me if I didn't submit to surgery, I was never going to walk again, all this stuff. Instead, I checked myself out of the hospital and just applied clay poultices, basically, and it got better. And then for the tooth, I didn't think it would work, but I just tried it. I was desperate, and I just put it on, the surface.
Yeah.
I didn't even put it in my mouth, and it was just amazing. Like within 30 minutes, it just like, I don't know, 70, 80% reduction in pain. It's just incredible. What is
it doing? I was going to say, what is it drawing out, or what is it putting in?
It just seems to suck out the inflammation. I've not been able to work out the biochemistry of it or whatever. It just goes to show that the whole theory that a lot of health problems are caused by toxins, may be more pertinent than we think. Who knows how superhuman all of us might be if we were genuinely toxin free. But just putting this bentonite on you, I don't know. It seems to draw stuff out. It makes much more sense from a Eastern medicine energetic point of view because it's so cooling and moist. Inflammation, the word flam is like flame, it's fire. So it just like sucks out this fire energy and cools it and soothes it. And yeah, as I said, much more effective. I tried it. I tried paracetamol, I tried ibuprofen, I tried this super strong painkiller that my wife got from Czech that's illegal here. And I must admit, I got a bit of relief on that, but it also sent my heart rate like over 100. And I'm like, I'm not doing that again. That's not, that's not worth it. I didn't have access to any opioids, but again, I just have not found those effective myself. So that's a really good one, especially if it's anything topical. Now, obviously, you can't put it, like if you've got a big burn or a big cut or something like that, you can't put it on like an open wound or anything like that, but you can still put it around the area. And certainly, like, I don't know, if I broke something or, something like that and it was all swollen, it would definitely be something I would use. The other thing I want to kind of move on because we've got a big list here. The other thing I just put in this category, if you have long-term pain, would be low-dose naltrexone, which is so that's if you've got long-term inflammation as the cause of your pain, rather than just taking ibuprofen day in, day out. I would definitely look into low-dose naltrexone. It's not going to be as immediate, but it's kind of more resolving a root issue potentially.
Okay, good. Well, I mean, these are nice options because, as you said, with some of those, there's that possibility of liver toxicity and everything like that. And with toxins potentially being one of our biggest things that we as humans need to overcome, we want to make sure that we are limiting what we're putting in.
Exactly.
So our next category, Owen, I've seen this quite a lot and people are on them, so I'm interested to hear what you say, statins.
Yeah, this is an interesting one. So when I first pulled up this list of most commonly prescribed medications, sometimes stuff didn't come to me straight away. And for this one, like my first thought was actually thyroid. So what are statins used for? Let's just go, rewind a second. So statins are to lower cholesterol. Cholesterol. Now, is it even a good idea to lower cholesterol? That was more my first response. So statins just basically, just to simplify things, they reduce your body's production of cholesterol. Why is that a good thing? Well, the idea is that high blood pressure is one of the biggest risk factors for a heart attack. And so what causes high blood pressure? Well, a few things, but fundamentally, if you have a tube and then a lot of that tube is just caked in stuff like cholesterol, then less liquid is going through and it's going to be under more pressure and it's going to raise the blood pressure. And so that's the thinking behind it. High cholesterol equals high blood pressure equals eventually heart attack. That's the simple thinking from a medical model. Now, cholesterol is meant to be converted into a few different things. One of them is vitamin D3 and another one is pregnenolone. And pregnenolone is the first of the steroid hormones, and then pregnenolone gets turned into progesterone or cortisol or DHEA, and then DHEA gets turned into testosterone or estrogen or DHT or any of these things. And so a lot of people are already low in a lot of those things. Plenty of people, plenty of men are low in testosterone, plenty of women are low in progesterone, plenty of people as they get older are low in DHEA of both sexes. And so does it make sense to, on one hand, as many people are doing, take a drug, like take testosterone or progesterone, and at the same time, take something which reduces your production of the precursor to those hormones? It doesn't super make sense to me. Now I won't even, because it probably deserves a whole other episode, and we've kind of done this already we did the episode on cardiovascular health, so check that out if you want to hear the whole story in this. But is it even a good idea to lower cholesterol? Well, again, that's debatable, but let's say that you're at a level where it is, like even by your own standards, you decide that it's too high. So then how should you do it, right? So, as I said, my issue would not be you're producing too much cholesterol, assuming it's too high at all. My issue would be not enough of it is being converted into the next thing. It's getting stuck along a chain of transformations. It's getting stuck as cholesterol instead of turning into pregnenolone, which is this fantastic anti-stress hormone and the precursor to loads of other cool hormones that you might want, like testosterone if you're a man. And so why don't we help the conversion into the next thing rather than blocking your body being able to make the thing? Does that make sense? To me, that makes perfect logical sense. And so what's required for that? And there's a couple of things, but usually the rate limiting factor, the thing that's stopping it, enough of it turning into the next thing, is thyroid hormone. And this is so much the case that before they discover the TSH test, which is usually the only thing that the very conventional doctors test if they're testing thyroid function, before they even discovered that, decades before, they would primarily diagnose and prescribe thyroid based on symptomology. But the one blood test result that they would look at is cholesterol, because everyone knew, even 100 years ago, that high cholesterol in your blood test means you're probably low thyroid. And I see this again and again. Any doctor who knows about this stuff, like Dr. Miriam, has seen again and again. If you give people enough thyroid, their cholesterol goes down. It's almost universal. So that is an option. But I did want to put something else in there. First of all, because I said I wasn't going to make this all about hormones. And then second of all, because there are some people where that's not the issue, to be fair. So I was challenged myself. Is there something more universal that even those who don't need thyroid hormone for whatever reason can take? And the answer is yes. And it is something I've discussed before, but in a completely different context. And there's something that is medically allowed to be prescribed for this purpose that I would recommend. And it is cholestyramine. So cholestyramine is a bile sequestrant. And we've talked about it before in that context. We've talked about it so bile is where your liver kind of puts your toxins to then transport them out of the body, hopefully. Problem is, over 95% of it gets reabsorbed in the small intestine, usually. And so in our community and in like this SIDS community, the chronic inflammatory disease syndrome, the Shoemaker protocol, the guy who just realized, decided that mold toxicity was a key cause of a lot of health issues. It's one of the kind of key treatment parts of that is to take this cholestyramine to stop the bile being reabsorbed so the body gets the mold toxins out. Okay. But it's also potentially recommended to anyone who's interested in toxic bile theory because it's much more effective than anything, including activated charcoal, although activated charcoal is much cheaper, much more easily available, potentially better for most people. I'm not saying not to use charcoal, but cholestyramine is really the gold standard of like 100% stopping that bile from being reabsorbed. Now, cholestyramine is actually available on prescription, like your doctor, should they be willing to, can prescribe it to you for the purpose of lowering cholesterol, because that bile, a lot of the bile is made out of cholesterol. And it's, toxins and a bunch of other stuff, but a lot of it is just cholesterol. And so what happens if you stop most of that cholesterol being reabsorbed in the small intestine? Over time, it goes down. And so the dosage are quite high on that. I think it's like 20 grams a day of cholestyramine, something like that. That's the amount that's recommended to actually lower cholesterol. But if you did go to a doctor, like, okay, let's put it my way. If I went to a doctor and they said your cholesterol is low, I would like to prescribe you something to lower it, I would say, okay, I would like cholestyramine, please. That would be my response. Because then I'd be killing two birds with one stone, as it were. I would be lowering my cholesterol a bit to keep them happy, and I would be stopping my small intestine from reabsorbing a load of toxicity from my bile. So I would be very happy with that result personally. So that would be my other recommendations to statins.
Right. I mean, that, because it doesn't seem, well, I mean, this is just me over here in that space, that the people that are on statins, it doesn't really seem to be doing the job so well. It's just kind of something that you go on at this point in period of time, because I haven't seen anything where it's going to reverse or make it better. But so hearing about cholestyramine, it's really looking at everything that we've talked about over many episodes, could be really supporting in a way that is more beneficial than a prescribed statin. But again, it's choice, it's education, and it's figuring things out.
Way more beneficial. It's got a bunch of other benefits. As I said, I wouldn't really take it to low cholesterol unless your cholesterol is really, really, really high. But if I was offered something to lower cholesterol, it would be my choice.
Okay. Great.
Other than thyroid, and I would start with thyroid because to me, high cholesterol is usually a sign of low thyroid. But if I'm sure that's not the issue, or if I just want cholestyramine anyway, then I would do cholestyramine.
Okay. All right. Great. One to look into for sure. Yeah, because you made that point about charcoal, so I'm glad you mentioned that, because it's like, okay, well, which one? But you're saying that the cholestyramine is much more effective than the charcoal at being that cholesterol sequestrant.
Bile sequestrant, therefore also cholesterol. No, you're right. I haven't seen any study. It's funny because charcoal does also adsorbs bile, but I haven't seen any studies showing that it actually lowers cholesterol. As I said, with cholestyramine, there are studies, and it's so established that it's one of the kind of official reasons you're allowed to diagnose it as a doctor.
Genetic Insights provides cutting-edge, affordable DNA testing, giving you access to over 500 health reports that can help you in 3 key ways. They may be able to resolve your existing health challenges even when nothing else has worked. Using simple lifestyle changes, their reports can help you reduce your risk of developing future health challenges that you may be genetically predisposed to. And they can help you feel more confident in your health by showing you where you are genetically strong. Unlike most other genetic health testing companies, Genetic Insights tests over 83 million different variations in your genes, guaranteeing 99.7% accuracy across all of their DNA reports. They cover almost every aspect of health, including digestive issues, cardiovascular health, weight loss, hormonal and blood sugar balance, as well as nutrient needs, allergies and intolerances, and so much more. Using their system is quick and easy, and reading the reports is simple. If you've done an Ancestry DNA test, you can simply download your raw DNA data, upload it to the Genetic Insights platform, And within a few hours, you will have access to genetic reports which give you a risk score for each specific issue and scientifically validated recommendations based on your individual genetic profile. Everything in your reports are based on scientific studies, and there are citation links throughout every report. If you are serious about optimizing your health and wellness and feeling great, then getting access to your genetic insights reports may be the most important health investment you will ever make. In the reports, not only will you gain insights into how to overcome existing health challenges and avoid future issues, you'll also discover which types of dietary, lifestyle, and even supplement protocols are best for your unique genetics. To get your unique genetic health reports, go to geneticinsights.co and use code Rejuvenate to get 20% off today. That's geneticinsights.co using coupon code Rejuvenate to get 20% off today. So now we're going into our next category, and I believe pretty much almost, well, at least I would think everybody's had some experience with this one, antihistamines.
Yeah, it's funny because I'm in my 40s now, and I only have done very recently. It took me an extremely long time to realize that I actually had, I don't know, I had a cat allergy in my 30s to our first cat. And just, again, it just doesn't occur to me to take drugs. So that's been most of my life, but I'm very unusual in that regard, I know. And interesting, because I'm not making myself out of how great I am, because actually I realized I had have looked into this earlier. Because there are some antihistamines, again, which have a bunch of other benefits, like we talked about with, I suppose everything so far, aspirin, cholestyramine. So histamine, so just to be clear about histamine for a second, histamine is actually a neurotransmitter. It's not just the allergy compound, right? And it's actually a, what's the word? Maybe not excitatory, but basically it's not that dissimilar from dopamine. Like it's a wakefulness neurotransmitter, let me put it that way. So the substances that really increase feelings of wakefulness, and I think like modafinil is one we've talked about. That's literally, it's not on our top 10 list here, but it's literally what they will prescribe to you if you have the blanking on the name, but the falling asleep at any time disease.
Narcolepsy.
Thank you. Yes. Modafinil, that's what that's for. So histamine is in that category of wakefulness neurotransmitters. And so antihistamines generally, there's like a drowsy and non-drowsy formula, right? And so things that reduce histamine have the potential, although the more newer antihistamines don't have this necessarily or as much, of calming you, relaxing you, because if you actually reduce histamine, then you will, tend to reduce one of the wakefulness neurotransmitters. That's something to be aware of. Another thing for men is actually histamine is crucial for erection quality as well. So if you really suppress histamine, then there is it's not necessarily going to cause ED, but it is a factor, and it could, be the final straw that causes AD, but it's like one of many, many things potentially that could be a contributing factor. Oh, and then histamine is also related to creating stomach acid, which we'll talk about in a bit. So histamine does serve a bunch of useful functions, and I just want to preface it with that because a lot of people are like, it just seems like there's really no downside to reducing histamine. A lot of people act like, even within the kind of health space. So I just wanted to point that out.
Yeah, I think a few people might be very upset if they lose one of those aspects. So yeah, it's good to point out.
Yeah. Now, having clarified all that, histamine can obviously make our lives miserable. It's not, it has a lot of downsides as well. It tends to go along with the quote unquote bad neurotransmitters. So it tends to go along with estrogen, cortisol, serotonin, like it's in the kind of stress category as opposed to the good ones like dopamine, GABA, things like that. So there are usually several benefits to reducing histamine, potentially, among some of the best drugs in this category. Now, we'll just preface it to say, I have tried loads of different supplement stuff. There's quercetin and curcumin and pyrroliseed and all the rest of it. I will say that to me, this is in the same category as painkillers, where there's a bunch of stuff out there that might help to some degree, but nothing's really as effective as the drugs. Although actually with painkillers, I must admit, I did say with CBD, I found, it to be more effective than drugs, but maybe that's not everyone. But So for antihistamines, I can't, in the same way I don't blame people for taking a painkiller, I also don't blame people for taking antihistamine, because I admit that in the supplement world, there is often nothing that is as effective. I'm also not so against it, just like I was talking about with aspirin, because there are some other benefits to some of the antihistamines. And the two that I would say that I've had experience with now and I'm a little bit of a fan of, although of course all drugs should be taken with extreme caution and all of them definitely have side effects, would be cyproheptadine and famotidine.
Right now, I've never heard of those two because, like, when I'm ever looking around, I know I'm used to the brand names, but looking at it, like for me, it was the Zyrtec with the cetirizine and then the Puriton, and I can't remember what that one but so I've never seen those around that you've just
Yeah.
mentioned.
So Cipro I heard about through the Dr. Ray P, and famotidine I heard about from Dr. Miriam, although I later discovered that it's also a little bit popular in the Ray P community, although not as much. Benadryl is also quite popular in the Ray P community, but I have not had experience with it. The benefits of it are not as impressive to me. So, it's kind of third on the list as something potentially to try. Um, the reason I generally have not I've tried them like a handful of times, and I'm better now, but I used to kind of always tend to be dry, like dry sinuses. Years ago, I even had a dry mouth all the time, this kind of stuff. And so I found antihistamines drying, and so I just didn't like them. That was my personal. Actually, that's the other reason I never took them. It just wasn't worth it to me. But so cyproheptadine is an antihistamine, but it's also a strong antiserotonergic. And so I will not talk about in detail why that is a good thing, because we did a whole episode on it a while ago, which I'd encourage people to watch. But in a nutshell, it's it has a lot of it has some very significant benefits, I'd say, Cipro, other than the antihistamine. So first of all, just talk about what it is. It's a H1 receptor antagonist, and the H1, there's 4 different histamine receptors. The H1 is the most related to actual allergies, like IgE reactions, pollens and cat hair and all that kind of stuff. And so it's quite effective. And actually, I looked this up because I was looking at the different strengths of things. And when I looked this up, it said cyproheptadine is actually far more powerful as a H1 receptor antagonist than the common over-the-counter antihistamines available in this day and age, milligram per milligram. And the only reason it's not used as much is because of its significant side effects. But then when I look at what those significant side effects are, I didn't find them undesirable. So one of the significant side effects is that it is more drowsy. So it's definitely more likely to put you to sleep. But then what about people who struggle getting to sleep? So it's not in the top 10, but I would put cyproheptadine not only as my number one antihistamine recommendation, I would now put it in my number one sleep recommendation. Far better than Ambien, which is dangerous. Far better than any of the sleep medications, because they're all like hypnotics, meaning they don't actually let you have better like deep sleep or REM sleep or anything. All they do is kind of knock you out, which, if you really absolutely need it, is better than nothing. But, for sleep, I'd obviously recommend other stuff as well, like melatonin and, whatnot. But in the drug category, Cipro would actually be my number one recommendations. And there's a bunch of studies that talk about this, how like really it should be considered as that. It just never was. But I agree that it should be. And it does have it's so powerful that you have to dose carefully. And it is true, you could wake up the next morning still feeling very drowsy or groggy. But that's also true of melatonin. That's true of any of these kind of hypnotic medications. So to me, that's not, so significant. But it's something that you'd have to be aware of. I haven't seen the research on it, but I wouldn't be surprised if it's also an anti-cortisol agent, and that's why it makes you feel a bit drowsy the next morning still. And so that's not a problem if your cortisol tends to run high. And I've also had clients use it and they have no problem with it at all. They feel fine the next morning. But let's say if a client's cortisol ran low in the morning, I might be a bit more hesitant. But yeah, just in terms of effectiveness, I find it, like, as I said, like dose per dose, significantly more effective. In the literature, it's supposed to be significantly more effective. And I think the big reason it's not used is because there's controversy around serotonin. I think as SSRI started to be pushed as a good thing, and serotonin was kind of relabeled as the happy neurotransmitter. The other thing, it also has another interesting Cipro use case. It's often used by apparently certain ethnicities in the US and Latin America as a appetite stimulant. And this is among ethnicities that kind of want to put on weight. They take it because it increases their appetite. And I my understanding of that is that, again, it's the anti-serotonin as well as the antihistamine effect, that basically. And so the other thing that I have heard about it being used for very effectively is IBS and all kinds of digestive issues. In fact, there's a lot of people who, if they take it, it just cures it. And then they're like, still, okay, well, I don't have to carry on taking this drug for the rest of my life. I need to, work out the root cause. But basically, there are back to this idea that the gut is like the root of everything. So there are certain bacteria in the digestive tract that produce a lot of histamine. There are certain bacteria in the digestive tract that produce a lot of serotonin. There are certain bacteria that produce both. And so if you have an overgrowth of those, especially if you have an overgrowth in the small intestine, it can produce this extra sensitivity of the mesenteric nervous system. Like, that whole area becomes overly sensitized. It can produce excessive contractions. Serotonin causes contractions of the peristalsis, and so but it doesn't necessarily stop contractions to reduce serotonin, because it can be like, if there's too much serotonin, there's too much contractions, and that's I'm struggling for words there,
No, it's
Chrissy.
okay. But like, I know with people that have IBS, I mean, they usually have these loose bowels. So I'm assuming that all those contractions are what's causing and pushing that through, which could then therefore be that over, too much serotonin in the gut.
Yeah, the classic IBS-D, as you just said, too much serotonin, simple. But even the IBS-C, spasm, that's the word I was struggling with. So if the contractions cause spasm, then actually it stops the process, and that's then leads to constipation. So it can actually go in either direction. And so both IBS-C and IBS-D, people will have it be resolved by cyproheptadine. So Cipro is potentially a big deal. I'll put famotidine in this category as well. I think we'll talk about famotidine more when we talk about a different category. But famotidine is a H2 receptor antagonist. So that's why we'll talk about it more in a different category. But it is also very useful for MCAS. So MCAS stands for mast cell activation syndrome. So this is a person who just is kind of allergic to everything. So it's very different and specific. If a person's has specific allergies, as I said, pollen, peanuts, maybe not peanuts because they're sometimes more serious, but whatever. There's non-life-threatening allergies. Cipro is very, very effective, whereas famotidine, in the case of antihistamines, can be very effective, not as a traditional antihistamine, but more as if you're sensitive to everything, it can stop that process where the mast cells degranulate too much. So and release histamine into the system, more related to the gut and the digestive tract specifically, from my understanding and experience. But famotidine, again, is a strong anti-serotonergic, I believe anti-estrogenic as well. It has a lot of those other things that, again, make it quite popular among the vapey community. And so if someone has kind of allergy issues and they want to take a drug, those are usually my go-to first two.
Okay. Yeah. And you did mention that, it's the H2 blocker. So in that H2, it's something that's going to, because I know we'll probably get this into the other category. It's just understanding what that is a little bit more in depth. That's
So
all.
that's usually focused on for stomach acid. So we'll talk
Okay.
about it in that category.
Okay, perfect. Great. Okay, gosh. I'm hearing so many things I had no idea about. So this is really, really fantastic, especially if I do come across some friends or anybody else is like, have you heard about this? Have you heard about that? And I'm going to say, you need to check out this episode. All right, so we're moving on to our next category, anti-diabetics. So tell me a little bit about, the overview.
Yeah. So this again is a big, topic that we've touched on a few times now. We had a whole episode on hypoglycemia, two different episodes on insulin resistance, one a full guide, one more of an overview. We haven't done an episode on diabetes, but we kind of have because the insulin resistance is when it comes to type 2 diabetes, and that's really the category that we're talking about here, that I'm talking about today. That's, by far the most common type. It's always preceded by insulin resistance. So definitely if this is, a diagnosis that you've been given or that you're worried about because your family members have it or whatever, definitely watch those episodes. But let's get to that. I've gone to the doctor. My blood sugar is a little bit high. She says, I could offer you a medication for this if you want. So what would I say in that situation? Okay. Well, first of all, obviously, diabetes is one of those ones where there's a very strong argument to be made for the people who like saying, you don't need drugs, right? You just need to change your lifestyle. And it's absolutely true. And so, again, we've discussed that in details in previous episodes. But let's just address the drug aspect of it, as that's what this episode is about. So, I would say that if it were me, I might consider metformin.
And why would you? Yeah, I was going to say, why would you consider metformin?
Yeah. It's because within the anti-aging community, there's a lot of people who take it on a daily basis just because they say it's really great. So they're taking it every day. They plan to take it for the rest of their lives. So, why is that the case? Well, it's, I guess, because insulin sensitivity, or the opposite, insulin resistance, which is the problem, is such a big predictor of all-cause mortality, so being killed in general, as we talked about in detail in those episodes, that taking something that lowers blood sugar, again, if it's excessive, that balances blood sugar, that, is an AMPK activator, which is that gene that kind of starts the process of autophagy, like breaking down old cells. Basically, you get some of the benefits of fasting without fasting from taking metformin. That's probably a simple way to put it. And so I've kind of considered metformin before in my, endless research, and I've decided against it because I'm not a candidate for it. I'm not overweight. I do not have high blood sugar. I do not have even early insulin resistance. I do not have it at all, and so I do not consider it worth doing. But as I said, if I were in that position where none of those things were true, and if I were a candidate for it, I definitely would consider it. Now, I probably wouldn't do it because without first trying berberine. So berberine is berberine is a plant compound. It's an extract of a bunch of different fairly common herbs used for health purposes, and I would just use that because it has, I don't know, maybe 60% of the strength of metformin in terms of insulin resistance and blood glucose lowering, while it has maybe 20% of the side effect profile. So to me, that's just a better risk reward basis. Now, if that's true, why do some longevity enthusiasts use metformin anyway? They have a different opinion on how strong it is, I'd say, basically. They just consider, metformin is significantly more powerful than berberine. And so this may be a case by case. And so that's why I would use berberine first. I would use a bunch of other stuff, and I won't list them all because we just did them recently in my complete guide to insulin resistance episode. But berberine's number one. And there's this, cinnamon, I guess, is another one, and maybe carnitine, beta-alanine. But again, I won't explain those. We talked about those.
Well, I think it also means going back to, as we were talking about what I discovered in the, my histamine, it's like trying to figure out the right one that's going to work for you. You may be somebody that berberine does a fantastic job for. On the other hand, you may not be, and metformin is what's going to make the impact for you. So like you said, case by case.
Yeah, exactly. And, case by case for effectiveness and case by case for side effect profile, right? Because every person is different in that regard. So, both of them, berberine and metformin, can create some digestive discomfort. And my understanding is because both of them are doing a similar thing, like they are killing a bunch of bacteria, often, the bad bacteria. The idea is that, at least the research says that Akkermansia, which is probably, when we talk about beneficial bacteria, there's kind of three classes that are normally thrown around. There's Lactobacillus, Bifidobacterium, and then Akkermansia. Akkermansia is probably the least well-known of those three, because it's way, way harder to get in supplement form or, in fact, in food form. It's not like in yogurt and stuff like that or whatever, but it is just as important. And Akkermansia is like high levels of Akkermansia are associated with being a lower weight. So people with Akkermansia tend to be thinner. People with higher Akkermansia tend to have more balanced blood sugar. People with Akkermansia tend to have lower levels of insulin. So I don't think it's been proven, but that it's possible that the main mechanism of these things, even though a bunch of other mechanisms are talked about, is just that it kills other bacteria, allows Akkermansia to thrive, which then has all these benefits. So that even that isn't 100% clear. But yeah, I agree. I would start with berberine, maybe try some Ceylon cinnamon, a couple of other of those natural things. If it were not an emergency, as I said, if my doctor was like, would you like me to prescribe it? I would say, let me try this first. And then, okay, if that doesn't work, sure. Because I'm just a researcher and I'm my own guinea pig, I might try the metformin anyway. But yeah, it's the only one I would try, because it's the only one out of all the list that I know of that actually has a bunch of real potential benefits, at least.
Yeah. Okay. I mean, I have heard metformin. I mean, I've heard other doctors speak on it too, and they speak very highly of it. So, and it is something that's been out there for quite some time. So, I do believe it's been tried, tested, and it's been working. So if that's all, it's one of those things to definitely consider.
To treat symptoms or to treat lab results, and one thing that has to be clarified is it's not resolving anything, right? Like
Precisely.
the lifestyle and diet still has to be addressed. But
right. Yeah, absolutely. And as we know, insulin resistance and diabetes, they are prolific throughout. I mean, before you used to think it was more of for somebody that was overweight, but we are finding that is not the case these days. So yeah, it's definitely on the rise. So check it out. So as we move into our next category, antidepressants. So talk to us about, where your recommendations are with this category, Ellen.
I think this one, along with the cholesterol one, is probably where there's like the most faulty thinking in the mainstream medical community about, what even the problem is. And so just like, I think high cholesterol is probably not even a bad thing. It may be a sign of a problem, but it's not really a problem. Now, depression certainly is a problem, but what they think of as the cause, I do not agree is the cause. So they think of it as like a lack of serotonin or a lack of, norepinephrine, noradrenaline. That's the other thing that's commonly focused on. It's true that, a high enough amount of noradrenaline will kind of shock you out of depression because it is a stress chemical that's highly energizing. So, some of the medications that are used raise noradrenaline. That makes some degree of sense to me, although I don't love it. Raising serotonin is very, very dubious to me. And I don't want to go into a massive thing because it's going to take a while to explain this, because I've done it before. And if you want me to do it again, tell me, and maybe I'll do a whole episode on this. But we've already done a whole episode on serotonin and why it may not be something that you want to raise. So I would not take any of these things really, no matter what. That's my position. I'm not telling you to do that. I'm certainly not telling you to stop, because it's not easy to get off them. But that would be, if I was extremely depressed, that would not be the path that I personally would choose to go down. Because I'm dead against drugs. I hope that's clear by this point of the episode, but because I think that the thinking behind it is just fundamentally faulty. So my understanding is, look, depression is complicated. The kind of more in favor thing I've seen these days, even among kind of medical professionals, is to say that, depression is not a neurotransmitter imbalance. It's actually caused by inflammation in the brain. I might have said that before. I think there's some validity to that. But I also think there's validity to the point that basically, nonetheless, if you just raise two different brain chemicals in people, they will no longer be depressed. So even though you could say the root cause is something else, maybe it's chronic inflammation or whatever, like shifting these neurotransmitters will make you not depressed. Number one would be dopamine. Dopamine is the chemical of motivation. It is the chemical, I associate with words like passion, enthusiasm, motivation, energy, drive, desire. Like these are all anti-depressing words, right? They're the opposite of depression. With depression, it's like, it's sadness, futility, feeling stuck, feeling heavy and weighed down, feeling bleak, feeling, meaningless, feeling drained, feeling weighed down, all these kind of things. So they're exact opposite qualities to me. And there are actually a small category of drugs that do actually work by raising dopamine in the antidepressant category. Wellbutrin is probably the most well-known one. I've spoken to some connoisseurs of these substances, and I tend to say, Wellbutrin is very effective now, and more effective, in fact. Now, I probably also wouldn't take Wellbutrin because it has the same problem that all dopaminergics do, which is they're all, highly addictive. We've talked about that a lot in several episodes, including a whole episode about dopamine. So again, I won't go into that. But to very quickly summarize, dopamine is something that, sure, you can take something to raise it, but your body will immediately lower it lower than it was before. So that's the challenge with anything. And so you kind of have to keep taking it. It's very habit forming. That would not be my preference.
Yeah, because I was also going to say too, I mean, like dopamine, isn't that one of the biggest things that we associate with addiction? And that's why, you got to be careful with things that are doing that.
Yes, yeah. And dopaminergics are much more commonly prescribed for ADD or ADHD than they are for depression. I think they would work just as well if they were prescribed for depression, but they're not for whatever reason. And you can get into conspiracies or whatever about it. But I wouldn't, if nothing else works, I might take something like Wellbutrin, or I might even take something like Ritalin or something like that if it were offered to me. I would definitely, personally, still choose that over any SSRIs or SSNIs. No, what is it? The noradrenaline ones, I can't remember how they say it. But I would try some other stuff first. So first in that category of stuff to try, and I'm only going to talk about this briefly because I said I wouldn't be doing hormones again because we've done it so many times. But T3. T3 is the active thyroid hormone. I think I talked about this before. I think I might have sent you a study link back when we talked about it, Chrissy, that, T3 is shown to resolve depression in like 100% of cases where it is mild to medium, and still over 50% of cases, something like that. I think it was more than that, maybe 60% of people, even when it's severe. Like, to me, dopamine is the motivation molecule, but thyroid's actually the joy molecule. And so both of them are very anti-depression words or concepts, if you think about it. And so it's true, if you have motivation, but you still are joyless, it's like, you can still be kind of depressed, I guess. So having both together really is like fantastic. Okay, so let's say I've already done T3, it wasn't enough, or I'm not going to do T3 because my thyroid's already high. What else is there? Okay, so one of the commonly talked about things these days that people do a lot for depression is microdosing, right? Some of them microdose LSD, some of them microdose mushrooms, some of them microdose ketamine. Ketamine is something I actually would also consider if I were depressed, certainly before SSRIs. I'm reading it here on my list, but just thinking it through. I hear better things about it. I think it's potentially more beneficial as well. But before I would do that either, let's look at the microdosing thing again. So microdosing is shown to be very, very effective for mood. I think I saw a huge meta-analysis of dozens of all kinds of things, with activities like, dancing, running, blah, 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 supplements and medications of all kinds. And the most effective thing that was shown for reducing depression out of all of those things Number one activity was dancing, which is why I said that first. Remember that. But the number one substance, both drug and supplement, was microdosing LSD. Now, why would that be? So first of all, not recommending it. Never done it. It's a Class A drug. I am probably where you are, pretty much throughout the world, but I'm getting somewhere here. So when you take something like LSD or psilocybin, which is the magic mushroom active ingredient, when you actually take it, it kind of floods your body with serotonin, which is why people experience hallucinations and basically puts you into a kind of psychosis state. It's some people who have schizophrenia say it's like, it allows you to see what it's like to be schizophrenic for a few hours. It's very, very exciting, but also very disorienting and potentially, not easy to function. And so it does that. But then once it stops, it actually blocks that serotonin receptor. And it does that for several weeks at least afterwards. And so this is one of the reasons why a lot of people who really love these things, when they do it, they say, yeah, I had these amazing experiences, I saw blah, blah, blah. But then they say, but afterwards I felt so clear and I was able to make this positive change in my life. And, I wasn't depressed anymore and I overcame my PTSD and blah, blah, blah. It doesn't always happen, but it happens a lot. And my understanding of one of the mechanisms behind that, other than maybe whatever rewiring happened when the body was flooded with those chemicals, probably more important is because then these serotonin receptors are actually blocked very effectively,
right.
Inhibited and blocked really for quite a long time. And so now LSD is illegal, Class A drug, but what about other compounds which are in the same class, which do not create hallucinations, but which are just as effective at raising dopamine, as we've talked about already, and blocking that serotonin receptor? One of them is lyseride, and another one is metagoline. These are ones, especially metagoline, I've talked about before. Lyseride is definitely more dopaminergic, I would say, so it's better for people who need more dopamine. I personally prefer metagoline, although I actually rarely take it. I don't feel like I need it, but if I did, feel down anyway, that's probably what I would reach for, except for the other thing, which I'm about to talk about in a minute, which is even easier to get. And so that would be my first thing that I would go for. I wouldn't microdose LSD because it's illegal, but I would go for something like lyseride or metagoline and have low doses of that. I can tell you anecdotally, when I've tried on people with depression, when they have tried it, they loved it. It's not overnight, but then again, ulcerative colitis aren't overnight. They say you have to take it for several months before it starts to work. I find it takes less time than that with those substances. It's great. And the other thing I want to give a shout out to, and I mentioned this recently in an episode about ADHD, but it's also really fantastic for this, and it's saffron. Saffron extract. I sent you a link to it, Chrissy, if you can include it in the episode. It's shown to be at least as, if not more effective than the classic prescription antidepressant drugs. It's natural. Sure, the extract is in a supplement, but as I say, it's a food, right? You can eat it in curry, And in fact, if you're an adventurous cook and you are depressed, you should probably include a lot of saffron in your food. But potentially consider a supplement as well. What's focused on is that it increases, it has a little bit of serotonin increasing activity, but it's quite complicated. It's not as simple as that. It also increases GABA, which is your calming neurotransmitter. It also increases dopamine. It has basically a very complicated mechanism of action, but the kind of end result, bottom line of it is that, again, the meta-analysis I saw said combining saffron with an SSRI was the most effective, far more effective than anything else. That was in that particular meta-analysis. And, there's bias there because there's drug company funding and stuff like that. But it's still interesting that even with that funding and that, mainstream bias, they still came to that conclusion about the effectiveness of saffron. So that would probably be my order. I would start with saffron. I'd start with saffron. I'd definitely see if my thyroid needed boosting. I would then look at, things like lyseride or metagoline. If nothing works and I was really desperate, I'd try Wellbutrin.
In an ideal world, you'd meet all of your nutritional needs in the form of vitamins, minerals, phytonutrients, and more from the foods you eat. However, unless you prepare all of your food at home from scratch using the highest quality ingredients possible, the reality is that most of us need some nutritional support. Most of us need to take supplements if we want to look, feel, and perform at our best on a consistent daily basis. And this is especially true if you have genes that give you an elevated need of certain nutrients. And this is where Feel Younger can help. What I love about Feel Younger is that they offer a huge range of quality supplements and healthcare products formulated and endorsed by Owen Robinson, including must-haves like magnesium glycinate and vitamins B12, D3, and K2. And they do it at affordable prices with free shipping for orders over $50 without ever compromising on quality, purity, or potency. To learn more about how Feel Younger supplements can give your health a boost while supporting this podcast, please visit feelyounger.net and use promo code Rejuvenate to get 20% off your first order. That's promo code Rejuvenate for 20% off your first order at feelyounger.net. Right. Okay. Well, I mean, the thing that's nice, which is what you've given in this list, is choices. Because maybe not everybody, like you said, wants to go on a Wellbutrin, wants to potentially go on something that is, maybe harder to get off of. So by having those, but I like that also out of all the choices, you've given us the one that you would most likely go for instead, because as you're saying, you have a different view of what modern day views where depression is coming from. And I love, go ahead.
Sorry. And I'll just say, I just want to correct myself, like that order, I probably wouldn't be offered it by a doctor, but if I was, I would go for something like Ritalin over Wellbutrin.
Okay.
Because people who take those things, I mean, look, it's a drug. It's basically a form of amphetamine. It's addictive.
Yeah.
But at least you'll feel fantastic and get a lot done. So, yeah.
Yeah, okay. But again, it's choice, it's education, and it's being well-informed. I mean, and that's what we're here to do. Beautiful. Moving on to our next category, antibiotics. So this is widely out there, so I'm really excited as you jump in and pick it apart. I mean, most of us know why we use antibiotics, what we need them for, so it's really helpful to, hear your thoughts.
Okay. Well, I hope I don't disappoint you, because I'm not going to go through and give a detailed, if you have this infection, I would take this. I don't have the level of understanding about it, honestly. I don't have the level of experience with it. And more importantly, I'm not a doctor, right? But, I do work with a doctor regularly, and so I have some idea. Here's what I would say about it. The idea that all antibiotics are just going to wipe out all your bacteria is nonsense. This is an idea that I hear all the time in the alternative community. It is just not true. What is my proof it's not true? Well, first of all, just a theoretical proof. If that were true, there'd only be one antibiotic. There's dozens routinely prescribed. Why is that? Because some of them work on some and don't work on others. It's really as simple as that, right? So please get over the idea that, I can never have an antibiotic. And I say this because I know some people who say this kind of stuff to me. So no one course of antibiotics is not going to decimate all of your good bacteria. Yes, it is true, unfortunately, that generally your good bacteria are often more sensitive than the commensal ones. And commensal meaning kind of okay unless they get out of hand. And so it is true that a lot of the time, if you take a lot of antibiotics for a long time, it kind of devastates the beneficial ones more than the commensal ones. Often the commensal ones will grow out of control, and then the person will have problems, especially kind of usually gut-based. And so that's really what I want to talk about, is the gut-based antibiotics, because I think a lot of people in the health community, kind of people watch this again, are aware of this idea. It's very popular, especially in functional medicine, that the gut is the root of all health problems. And, it's not a new invention. I don't want to make it sound like that. It's something that goes back to ancient systems like Ayurveda and Taoist medicine, that they call it the Dantian in Taoism, or the Hara in Japan, or whatever. This center around the navel is the crucial element for health. And so it is true that the digestive system is very important. And it is true, if you take a lot of antibiotics, you're going to create these kind of imbalances in your digestive tract. And it's true that a lot of people I see, they have these issues, although not all. And so a lot of them are like trying to deal with it. And so that's really what I want to address here more. I'm not going to give, here's my favorite antibiotics if you have like sepsis or whatever. I think, deal with that as it is. Not the acute issues, but more the chronic issues, right? And so the chronic issues are like sinus. Generally, I don't think antibiotics are prescribed too often for sinus issues. Though sometimes they are, but like
sometimes they are.
routinely.
Yeah, when I was growing up, because I used to get sinus infections like 3 times a year, and the doctor would just always give me antibiotics. So it's like at least 3 times a year I was on them.
Well, I was about to say, but routinely, like not actually based on anything. So
Yeah.
usually it's not bacterial, it's like fungal, it's viral, it's actually something else. UTIs, I think it is more commonly bacterial, but I just don't have the experience with that, so I'm not going to comment on it. So it's more those chronic things I focus on. Skin infections again. Generally, I'll be honest, if I go to a doctor, I would just take what is given in most cases, but here's the exception. With the intestines, with the digestion, I would have a strong preference for rifaximin. Now, if you go to it, they will not want to give it to you.
Why?
Not because it's dangerous, not because it's got high side effects. The opposite. It's the safest, least side effects by far of all antibiotics. The reason they won't want to give it to you is because it's expensive. If you are in the UK or any country with socialized medicine, they're not going to want to give it to you because prescriptions like the same price for you no matter what they give you, and it's going to cost them like 100 times as much. And so it'll be in their guidelines, do not give, unless you go to a private doctor. If you're in the US, they'll probably give it to you, but it's
going to cost you an arm and a leg. I can tell you that right now.
I think it's like $1,000 per course or $2,000. It's quite a lot. Even in the UK, it's like, I mean, depending on the course, obviously, but you could easily spend a couple of £100 on it.
Just anecdotally, sometimes when I've been to the doctor in the past and like, yeah, here, go take this antibiotic. It's going to take care of it. This is in the States. And I'm like, oh, amazing. Okay, great. When I get to the pharmacist to fulfill it, that's when they're like, are you sure you want this? And there's a $700 price tag. And I do not. They're like, okay, I'm going to give you the generic version now because they can or whatever. It's like, no, it's just not possible. But
so the problem with rifaximin, there is no, the generic version's no cheaper. Like it's just expensive to make. Yeah. So the thing that's great about rifaximin is that it is less than 1% of it is absorbed in the intestine. So what's good about that? So generally, most of the commonly prescribed antibiotics have got quite serious side effects. What's one I was reading recently? Metronidazole, which I had during my tooth debacle a couple of years ago. It's like a mitochondrial poison. It's like all these serious side effects potentially. And it's like, there's almost any antibiotic, if you look it up, it's like seriously not great. And rifaximin is just this island of like okayness in a world of not greatness when it comes to antibiotics. And it's primarily because it's not absorbed. So any damage that it's doing is restricted to the digestive tract. That's really the thing that is great about it. And it seems to be, even within the digestive tract, it's really not bad. I've seen studies that show that like bifido and lactobacillus concentrations actually increased after taking rifaximin sometimes. Like it just seems to be pretty effective at killing the bad guys, not very effective at killing good guys, and almost none of it absorbed to poison and mess with the rest of the body. So any kind of digestive upset where it call for antibiotics, I would always ask for rifaximin first. Any exceptions, if the doctor had actually tested the contents of my stool and had ascertained it was this particular microbe and they were sure that rifaximin was not effective for that microbe, okay, maybe I'll go for something else. But that would be the only case. And how often do they do that? So basically, I would always go with rifaximin in this case. Now, that's quite a strong statement, Owen. What about natural stuff? Well, I would actually go for it over the natural stuff. I would go for it over garlic. I would go for it over grapeseed extract. I would go for it over oregano oil. I would go for it over, all of those kind of natural things that are commonly recommended, because what I just said about rifaximin is not true of those, right? All of those are absorbed into the bloodstream. They will, have to be processed by the liver. They will affect every cell of the body. Now, you could say that's not a bad thing, Each of those has been shown to have a bunch of benefits potentially systemically on the body. Garlic, famously can, lower blood pressure and stuff like that. But, that the kind of carnivore community that talk about how all these plants all have like these I don't want to be eaten chemicals in them,
Yeah.
they're kind of right, even though I'm not a carnivore. And some plants have stronger I don't want to be eating chemicals than other. And these plants that I just listed have very strong I don't want to be eating chemicals. That's what, these things that we're talking about are. They're basically poisons. I don't want to overstate it, but if you're killing something with any antibiotic, including rifaximin, it's a poison. It's a thing that's killing stuff. Same with an antiparasitic, same with an antifungal. It's a thing that kills things. And so I do not want that to go systemic if I don't need it to go systemic. If I'm trying to kill something on my, I don't know, urinary tract, and I'm not going to shove something up there, so yeah, I've kind of got to swallow it as a capsule in my digestive tract. I've kind of got to let it go systemic. But I would prefer just to keep it in my digestive tract. So that is why I would use rifaximin over any of those natural things, if it's available to me, if it's a digestive issue. Now, I'm not dead against those. I like mastic gum, for instance. I like that for especially H. pylori and those kind of more stomach issues rather than intestinal issues. It's very effective. I know Dr. Miriam said she's a big fan of using that. And often you've got to have like three or four different types of antibiotics to treat H. pylori. So I would definitely go with like a mastic gum first in that case, if that was the type of infection that I had or suspected I had. But yeah, so that's why I would use a herbal one. But otherwise, and even then, even for H. pylori, like no matter what it is, I think some functional medicine doctors, if cost is not the primary consideration, they just routinely go with rifaximin first because it is just so much less side effects. It's so much more, beneficial. Now, I know that we've mentioned repeat a few times. I know people in the repeat community are a fan of using like low doses of some of the other antibiotics, like I think doxycycline, monocycline, tetracycline, one of the cyclines at least, I know they're a fan of, even amoxicillin sometimes. And so I'll just talk about that as a general point. I saw someone, it was actually Hansamoto, one of our guests from a while ago, posting something on social media recently about how people are underdosing supplements. And I felt he made a good point. He talked about several things that I've talked about before as well, although I'm sure he came to the conclusion independently. And I just made this comment that, most supplements are underdosed and most medications are overdosed. And the more I thought about that, it was kind of an offhand comment, but I was like, yeah, this, nothing's universal, but it really is like a persistent tendency that I've seen where supplements, people are like, oh my God, I don't want to overdo it. But it actually, like, basically, it's such an opposite attitude. So let me explain the background of this a bit more to explain this antibiotic thing. So in the medication world, it's like you got a doctor behind it. They got their liability insurance. They've got their kind of status. They've got their backing by, the medical associations and, culturally and societally and everything. And so with them, like and the medications are like, for the pharmaceutical companies, they're difficult to go through the regulatory procedures to finally get them approved, except for that special class, which we can't talk about. And so they have to kind of prove that they work. And so they're always like, what's the maximum dose we can give people without killing them so that we can really show that this really, really works? And this is so often the case. And I've talked about this in the context of Ozempic. I just think maybe there's some value to this, and I can see for some people it does seem to be an overall net benefit, but I really worry about the side effects. And I talked about this with Dr. Miriam, and she's like, yeah, but I prescribe people like a fifth of like the minimum dose that, they usually start people with. I'm like, that makes sense. That I would feel fine with that in, a lot of cases. Like, it's so often with these drugs, it's like, like let's pick that one because it's so popular at the moment. Because it's like, okay, we want to make sure that it really works, and we're going to have studies showing that people definitely lose weight. So what's the most we can possibly give people and not kill them most of the time? That's kind of, And so that's the mentality, and that's the mentality with antibiotics as well, I think. And in acute situations, sepsis or whatever, makes sense. But a lot of time with these more chronic infections, I feel they're still using these really high doses that are not really called for. And so if you want to talk about any other type of antibiotics, then I think asking the doctor, what's the minimum dose that would be effective? And I'll just take it for a longer time, potentially. That might be an avenue I'd go down as well. If rifaximin wasn't an option, too expensive, or they won't give it to you, or it's not relevant for your particular infection, that's another thing to consider. It's just like, what's the minimal dose? And I'm happy to take it for longer.
Yeah, that's true, because especially at higher doses, the side effects can just kind of really wreak havoc on your system. Yeah, absolutely. Okay. Elwyn, as always, I love your dedication to research and the knowledge and the length and breadth you're willing to go to find things out, because you've opened my eyes into new things, especially with some friends or people that I may be able to point them in a direction, just to be like, hey, have you checked this out? Or maybe you want to look down at this, because having that education and understanding that there are choices out there, I think, is an invaluable process to people, especially when it comes to their health. I know we still have more categories to go, but we're gonna have to leave that for part 2. So I just want to come back to you real quickly before we close to see if there's anything you want to add before we end this episode.
I'll tease people for the next episode. So we're going to talk about proton pump inhibitors for excess stomach acid, bronchodilators, anticoagulants, antihypertensives, and then I'm going to throw a couple of others in there as little bonuses. We'll do a top 12 instead of a top 10. So we'll see what comes up, and if you have suggestions, put them in the comments. Just thank you for watching. Continue to share, because I see a lot of you are sharing on social media. Help grow the channel. We can't keep doing this forever as a loss-making endeavor. So support the channel how you can. You can subscribe to the channel on YouTube. If you're listening on YouTube, there's actually like not just subscribe, but there's I don't even know what it's called. I think it's the join button where you can pay us. I can't remember what I said. 99 cents a month or something very low, but just to support the channel that way. Obviously, you can support the channel by supporting our sponsors, which are all companies that I have a key input in, like Genetic Insights and Phil Younger. Thank you so much for your input. I always read the comments, and I just want to give a shout out to Chrissy. I never really thank her because of the way that we structure these episodes, but this podcast wouldn't exist without Chrissy. She, executive produces it. She oversees every aspect of it. Please give some love to Chrissy in the comments as well, and thank her if you're a fan of this podcast, because it wouldn't exist without her.
Oh, thank you, Owen. That means a lot. Thank you. And as always, everyone, we really mean it. We love doing this for you. So please continue to come and show up for us, and we'll continue to do so for you. As always, take care, and we'll see you next time.
Hey, I hope you enjoyed that video. You may have noticed I recommended a few different videos in that episode. And one of the ones I'd recommend is just here, if you want to click there. Or another one I recommend is just below, if you want to click on that one and watch that next.